Here we are this morning in the village of Villa Paraíso. We have clinic today. We have over 50 patients today. It's Tuesday, and we expect the same on Thursday and Friday. It's always a blessing for us to come here. There's so many people in need of medical help, and it's a blessing to us. Thanks to God, we have the provision to do that. Let's go inside and see what's going on. We have 4 days of clinics each week, and every week we see over 150 patients, ranging from the common cold to cholera, typhoid, sometimes cancer. But the major patient basis is high blood pressure. I would say 50 to 75% of our patients are high blood pressure patients. Many of them come for a monthly maintenance dosage, and many come when they don't feel good, but the majority of our patients are either high blood pressure, diabetes. We have many children with tonsillitis, and we do give injections for that as well as our medications. And when we get patients, it doesn't really matter to us what their problem is. We are going to help them the best way we can. Many times we're getting patients from Sosua, from other towns, 15 to sometimes 45 minutes away, and they're coming on public transport. A couple of patients ride their own burros, and so we are seeing patients, family members of the people that live in the villages, just friends that they know, that they tell about our clinics, because we have a good reputation. The Lord has blessed us with a wonderful staff. Dr. Lambert has a reputation of being a very good doctor, and the people come to our clinics because they know we are going to give them respect. We are always trying to love them with the love of Jesus Christ. That's our main objective. And this is a way that we can tangibly evangelize to all of our patients, that we are helping them medically, sometimes emotionally, physically, and sometimes we are even having to give food to those that are just not able to buy food for themselves.
Tina and Robert, we are working together and to provide medical attendance to the people. And today it's a big pleasure for us. Here we can see more 60 patients, 50 patients in one day with different kind of diseases. The patient, we have two different type of patients. We have the poor Dominican people and we have the Haitian people. The Haitian people, they have much problem because much of them, they don't have any document, and they cannot go to visit public health. They ask for a document and they don't have any document. They come to see us, so they don't need any document, and we provide a medical attendance to them and we help them.
She's my high blood pressure patient. She's our regular patient. Regular patient comes monthly for the treatment, and we give 30 pills for 1 month. Every month she comes, have to check to see the change. If blood pressure is normal, we still give the same medication for the next month. Any change, we can send to make some tests, cholesterol tests or other tests.
Yo tengo como casi desde que hicieron el centro, yo estoy viniendo aquí.
She's saying that she's very thankful for coming here. She's been coming here and she feels a lot better. We give the medication for free. It's good medication. And before, they were not able to purchase their medication. And in her prayers, she always prays for us, and she's living a life better. Muchas gracias, Juliana. The question has arisen, what would the people do if our clinics weren't open? Many of the people who are economically able to go to another clinic would do so, but the majority of our patients are not able to do that. We have a large basis of elderly patients, and they do not have the money to pay for transportation, then pay for their medication every month for their high blood pressure medication, and so they come to our clinic. I would venture to guess that if we were not here, most of them would not be taking medication. One of the main things that we're proud of is that we are able to help these people live a more productive life, to feel better, to be able to go out and work, to be able to go to school, to be able to take care of their families. Because if you have a chronic illness and you're not receiving the medication or taking the medication that you need, you just don't feel like doing those things. So we give all the praise to God that we are able to do that for our patients. And as you see in the testimonies from our patients, they're very happy and very appreciative for the things that we're able to help them do. Many people often ask us, what kind of things do you need in the clinic as far as donations? Number one, financial donations, of course, but also over-the-counter medications. We go through a lot of children's Tylenol, 160 chewables, Tylenol for infants, ibuprofen, aspirin 81 milligrams. We go through a lot of creams, anti-itch, antibacterial. If there's anyone who would like to contact us, I'm more than happy to give a list of the things that we need, and we are very grateful for everything that is given for our patients. We know that we cannot cure all the ills of a deprived country like the Dominican Republic, but we can love and care for God's people one person at a time, working alongside other faithful Christians.